There are some national issues. The Ministry of Health has been delinquent in their denial. Maybe because of the low fatality, they have been intransigent. They have not responded very well. The Ministry of Health's attitude has raised issues of incapacity. And I believe that when the body comes to speak, he will address some of those issues. What we are addressing today is what appears to be the social consequences of severe austerity programs, which has contracted the economy and severely compromised the ability of the Ministry of Health to respond meaningfully to emergencies such as this. We always have to make provisions that from time to time, especially this time of the year, there can be crises, not only hurricane crises, but the fact that we can have epidemics of diseases. The immobility of the public health staff, and as the chairman of the party just said, the fact that they have been unable to collect the garbage, which provides the additional breeding sites for mosquitoes. That is of great concern. Activities of surveillance, I have not heard anything to give me the confidence that surveillance is taking place as to how it should. In terms of mosquito breeding sites, the kind of mosquitoes that are there, the kind of fevers, the incidence of fevers. I am not hearing any daily reports on this or weekly reports. The resistance of the mosquito to the malathion, I have asked for it several times. I have not heard any reports concerning this. These are important issues. And the issue of public education. At this time, I believe that we should intensify our mosquito control program. We should look at issues of securing our borders, our ports, and our airports against the importation of disease. It is not just Jamaica alone. It should be a regional effort. And there should be a regional surveillance program to look at the pattern of diseases coming to our island. I have no doubt that CARPA, which is the Caribbean Regional Health Agency, is doing its job. But I think that there needs to be more urgency on the matter. Although Ebola is not here, it is not in the Caribbean as yet. But studying the experience of West Africa, it has spread significantly. 2,500 or 2,600 people have now died from there. 2,800, it's moving fast, have now died from Ebola. And the World Health Organization have indicated that based on the current trend, it could well be that 1.4 million people will get it before we control it. But there are some encouraging news from Nigeria, as I saw this morning, and that the superhuman efforts being made by the world is paying dividends. And some areas are responding in that the rate of spread seems to be diminishing. But Jamaica must still be careful, as the rest of the Caribbean, that touring parties visiting West Africa or any other countries must be counseled before they go. This is the usual thing with travelers to other countries, in that public health departments must be consulted so that you can have advice as to the pattern of diseases and what precautions, what prophylactic measures you should use, as in the case of malaria or yellow fever. And I'm not certain that that is taking place. I believe that people are going to these countries without consulting public health departments. But more importantly, when people return from their travels, they should be questioned at the airport. As they come through the airport, there's a health desk there. The desk needs to be activated. And anybody who on the immigration card has traveled through these countries in question should be interrupted at the airport. They should be stopped, they should be asked questions, and they should be given a card indicating what steps they must take and what to do at the first sign of illness. This is the way we secure our borders. It is a global situation. It is not anybody's fault locally. If we must just remember our experience with other diseases in the last 2 or 3 decades. In the 1980s, we were proud to announce Health for All by the year 2000. Actually, that started in the 1970s, when I was Minister of Health in the 1980s. But shortly after that, HIV occurred, started in the early 80s, and it has spread across the world. I don't need to recount the experiences with HIV. We have had severe acute respiratory syndrome, SARS, which has been a frightening epidemic. the H5N1 bird flu virus. That is influenza type virus, as is the H1N1, which is the swine flu virus. And memories of that still linger in 1990 when 100 million people died with a global pandemic. So CHIKV is just a new one. The reason being that the economy of the world, the serious global imbalances, the serious inequity, is causing people to forage into the jungles, to clear land for farming, to find food. And because of that, new viruses are being released into the system. This involves not only climate change, but the fact of global inequity in terms of the economic crisis that is affecting all of us in the world, but unequally and more so developing countries, and countries of the Central Africa, West Africa, and countries in South America. So therefore, what we need today is for Jamaica to become a part of the regional and global surveillance efforts, to set up a network of warning network, so we can be forewarned about any impending crisis. But the way we handle Chikungunya is a bit worrying, because it would appear that our capacity is impaired, and the Ministry of Health and the authorities are not prepared to respond in a very effective way. Thank you very much.